Supposed to heal ya, but I ain't done much healing. Hello.
Rad FM, Perth's raddest radio station.
That was Hello by Adele.
Pretty good song, isn't it, Ryan? Yes! So now it's time for RT What If. It's producer Tan's favourite. So we get listeners to call in with scenarios and we answer them. So we have our first caller. Hello.
Oh, g'day mate, I'm Derek. So you're on a Linac. A 7-year-old girl Mary is being treated for post-op cranial pneuma. Today is fraction 1 of 30, and as you're setting up she starts to cry, as well as her mum. And if Dad's there too, what would you do?
Oh, thanks for the question, Derek. Unfortunately, this occurs more often than you may think, and it's a tough time for the family. Getting the diagnosis, then prognosis, then she has surgery to the brain. It's pretty intense. Even I don't know how I'd cope. And now they're receiving radiation therapy treatment. There's so much going on and so many aspects to consider for this case. Firstly, the disease itself is rare, and with Mary being so young, and the family probably thinking, why me? What have I done wrong to have deserved this? And then we have to think about the parents who are just anxiously watching these strangers moving their little girl around and putting their tight mask on Mary. Then she starts to cry. It would be heartbreaking for any family, especially for the mum. So what I'd recommend for this situation is communication, education and care. People may think that, why do we have to educate or communicate with children? They don't understand anything, but they do. And my personal belief is what happens when your child lasts a lifetime. Future anxieties, being in a hospital, claustrophobia, the way you are as an adult is shaped by your childhood. Kids absorb everything, watch everything we do, say everything we do, and this is highlighted by an article by Jones et al. In 2009. And many studies, including a study by Cato 2008, revealed the importance of education and communication in paediatric patient care to improve anxiety and their understanding of their treatment. That's why we're lucky to live in WA with organisations such as Youth Cancer Centre and Canteen to help us out communicate. That being said, to answer your question, I'd take Mary off the treatment couch, find an RT who's good with children and play, because children aren't common in a radiation oncology centre, so many RTs may struggle communicating with children, and that's understandable. They don't really have anything in common. They can't talk about the footy or what they had for dinner. So some RTs may not understand how to communicate. So let Mary have a look around the room, use an iPad app or a Frozen doll, get her mind off the situation and build trust. Something engaging, something they can relate and have in common. Educate the child what is going on. They're anxious about the unknown. Mary's in this dark room with 3 staff plus her parents watching in. It's going to be pretty scary. An article from the American Cancer Society website explains that children rely on their parents for security and support. So when Mary starts crying on the couch, you can invite the mum or the dad to reassure Mary. Or maybe the dad because mum is crying too. And I've got to highlight and really, put the message out there that don't worry about treatment delays. In this situation, it's unavoidable. Working in a radiation oncology centre, we often think, we've got to get it done. We've got patients waiting for us. Take her to another room. You can treat another patient while this is going on. Let her play with toys. Let her get familiar with her surroundings. And build rapport with the family and the patient. And if you can, have the same RT, like a buddy system used in the WA Paediatric Radiation Oncology Centre. A familiar face every day, not someone scary or random. And education is important for the family, so knowing what's going on, telling them that we're going to be moving Mary around a little bit. Today we might be taking x-rays, it'll be a bit longer, just reassuring that everything is normal, and if there's delays or something like that, it's what we expect. This will reduce anxiety for the family, and anxiety of the mum and dad is sometimes put through to the child. So if mum's worrying, then the child might be worrying. So it's important to let what's going on be known by the family. And finally, consider actively seeking counselling services for the family, not only to cope with mental stress of the situation, but so the parents can be educated on how much information to share with Mary. It might seem weird teaching a mum and dad how to communicate with their child. But in a situation like this, it's quite unique. You know, how much do I tell my daughter or my son what's, you know, their diagnosis? So a counsellor can kind of break it down and make it easier for the family. So in summary, in this situation, you've got to educate the child about the unknown to improve anxiety, communicate and build rapport so the child is like, yeah, I know who this is. Ignore treatment delays. Use family to calm the child because that's who they know and trust, and seek counselling because what we do today will last a lifetime. Thanks for the question, Derek.